Every human being has the right to the best possible physical and mental health. Individuals and couples have the choice to choose how many children they want and when they want them. Infertility can prevent these basic human rights from being realized. You are not alone if you and your partner are having trouble conceiving. 1 out of every 10 women between the ages of 15 and 44 has difficulty conceiving. But what might be the cause of infertility? Subscribe to this channel, hit the button for more exciting videos. So, causes of infertility. Infertility can result from a variety of reasons in both the male and female reproductive systems. It could be caused by a problem with you or your spouse, or by a combination of conditions that impede pregnancy. To become pregnant, women must have functioning ovaries, fallopian tubes, and a uterus. Female infertility can be caused by problems with any of these organs. To become pregnant, all of the steps during ovulation and fertilization must be completed correctly. Some disorders that cause infertility in couples are present at birth, while others emerge later in life. However, the causes of infertility are not always easy to pinpoint. In the female reproductive system, infertility may be caused by ovulation disorders. Ovulation diseases limit the ovary's ability to release eggs. These include hormonal disorders such as polycystic ovary syndrome. Ovulation may not occur due to faulty ovarian function. Hyperprolactinemia. That's if a woman's prolactin levels are high and she is not pregnant or lactating, ovulation and fertility may be affected. Thyroid problems. Either too much, that is hyperthyroidism, or too little, that is hypothyroidism. Thyroid hormone can alter the menstrual cycle or induce infertility due to hormonal imbalance. Premature ovarian failure. And before the age of 40, the ovaries cease to function. Poor egg quality. Damaged or genetically defective eggs are incapable of sustaining a pregnancy. The danger increases as a woman becomes older. Uterine or cervical problems. Uterine or cervical anomalies, such as cervix abnormalities, uterine polyps, or the form of the uterus. Uterine fibroids are non-cancerous tumors that block the fallopian tubes or prevent a fertilized egg from implanting in the uterus, resulting in infertility. Tumors in the muzzle wall of the uterus are benign or non-cancerous. They can hinder sperm from fertilizing the egg by interfering with implantation or blocking the fallopian tube. Large submucosal uterine fibroids may distort the uterus cavity, causing sperm to travel a longer distance. Cervical surgery might result in scarring or a shortened cervix. Fallopian tube problems. Inflammation of the fallopian tube can induce fallopian tube damage or obstruction. Pelvic inflammatory disease, which is typically caused by a sexually transmitted infection, endometriosis, or adhesions, can cause this. Scarring or injury to the fallopian tubes can occur after pelvic surgery. endometrial tissue can accumulate in the fallopian tubes and obstruct them. Adhesions between endometrial tissues on the outside of other organs can potentially restrict the fallopian tubes. Fibroid growths, especially where they join to the uterus, might block the fallopian tube. An egg may be fertilized if a fallopian tube is partially blocked, but it may become stuck in the tube. Ectopic pregnancy occurs as a result, which is a medical emergency. Endometriosis. Endometriosis is a condition in which tissue outside the uterus resembles the uterine lining, that's the endometrium. Endometriosis can develop on the outside of your uterus, your ovaries, or tubes, as well as your bladder and intestines. This tissue can irritate the organs it comes into contact with, producing pain and adhesions, that is scar tissue. Many women with endometriosis experience pelvic or abdominal pain, which is exacerbated by menstrual bleeding or sex. Some women have no signs or symptoms. Endometriosis can make getting pregnant difficult. In fact, endometriosis affects 30 to 50% of infertile women. Endometriosis can sometimes grow inside your ovary and form a cyst, that is an endometrioma. Unlike other endometriotic tissue, this is frequently visible on ultrasound. A medical technique called laparoscopy is the only way to know for sure if you have endometriosis. Endometriosis can affect fertility in a variety of ways, including deformed pelvic anatomy, adhesions, scarred fallopian tubes, inflammation of pelvic structures, changes in the hormonal milieu of the eggs, impaired pregnancy implantation, and decreased egg quality. Primary ovarian insufficiency. When the ovaries stop working and menstruation stops before the age of 40. This is known as primary ovarian insufficiency. Although the cause is generally unknown, immune system illnesses, some genetic conditions such as Turner syndrome or carriers of Fragile X syndrome, and radiation or chemotherapy treatment have all been linked to early menopause. That is primary ovarian insufficiency. Primary ovarian insufficiency has symptoms that are similar to menopause or estrogen deprivation. So don't forget, hit the button before we continue. Subscribe to this channel, like this video, and share. Let's give ourselves 5 seconds to subscribe. 1, 2, 3, 4, 5. So let's continue. Pelvic adhesions. Pelvic adhesions are scar tissue bands that bind organs and can develop as a result of a pelvic infection. Appendicitis, endometriosis, or abdominal or pelvic surgery. If there are pelvic adhesions within the fallopian tubes, eggs cannot flow easily through the tubes, which is required for a normal pregnancy. Another possible difficulty is that the fertilized egg becomes stuck in the fallopian tubes, and the embryo develops there rather than in the uterus. Ectopic pregnancy is the medical term for this situation. If there are intrauterine adhesions, scar tissue causes sections of the uterine interior to be improperly linked together, resulting in diminished fertility. Cancer and its treatment. Female infertility is frequently harmed by certain diseases, particularly reproductive tumors. Radiation and chemotherapy both have the potential to impact fertility. Unfortunately, most cervical cancer treatments will prevent you from becoming pregnant. This is due to the possibility